Good morning, Mr. Chen. I'm very sorry for your loss. I know you lost your wife recently. How have you been holding up?
Thank you, doctor. It's been hard. We were married 62 years. Ever since she passed, I just can't sleep. I lie awake for hours, and when I finally do fall asleep, I wake up again in the middle of the night.
That sounds very difficult. Has this been happening every night since her death?
Yes, it's been about 10 days now. Nights are the worst. My mind just won't shut off. Sometimes I end up crying when I think about her.
That's completely understandable. Grief can really affect sleep. During the day, how is your mood?
I'm sad, of course. I tear up pretty easily when people ask about her, like now, but I wouldn't say I feel hopeless, just lonely.
Thank you for sharing that. Like, it helps me understand what you're going through. Let's also make sure nothing medical is contributing. Are you still taking your usual medications?
Yes, I take my blood pressure pill, amlodipine, every morning, and the terazosin at night for my prostate. I also take that weekly bone pill, alendronate, for osteoporosis.
Good. Like, any dizziness, especially when you stand up, since you're on terazosin.
Sometimes I feel a little lightheaded if I stand too fast, but nothing new.
Okay. And how about constipation? Are your fiber supplements helping?
They do help as long as I remember to drink enough water.
That's important, especially with fiber. Now, about your sleep, are you drinking caffeine late in the day or taking naps?
No coffee after lunch. I might doze in the afternoon, though, just sitting in my chair.
That can make it harder to sleep at night. What you're experiencing sounds like insomnia related to acute grief rather than a major depressive disorder. Given your age and your other conditions, I'd like to be cautious with sleep medications.
I don't want anything strong. I just want a little rest.
That makes sense. We can start with non medication strategies. Things like keeping a regular bedtime, limiting naps, and creating a quiet routine before bed. I can also refer you to grief counseling, which many people find very helpful.
Yes, you're right. I think talking to someone might help. I appreciate that.
If needed, we can also consider a very low dose sleep aid for short term use, but we'll avoid anything that could increase your fall risk, especially since you have osteoporosis and take terazosin.
I appreciate that. I don't want to end up falling.
Absolutely. Let's take this one step at a time. Grief takes time, and you don't have to go through it alone. We'll follow up in a couple of weeks and see how you're sleeping.